Well, I think if you'd have asked me in 2000, 2001 about whether I thought mental health was an issue that I needed to be concerned about, or indeed that would be an issue for our business, I would have said no. It's the sort of thing that happens to other people, and it's the sort of thing that happens in other kinds of environment. Yet in 2006-07, I found myself in a position where I was suffering from what I later understood to be very severe depression, and ended up having 3 months off out of the business.
About 18 months ago, I experienced some mental health issues that were largely connected with my work, so levels of anxiety to do with things around sort of workload and the type of work I was doing. And this meant that I had to seek help within Deloitte, and it was very, very useful for me to have access to a mental health champion within Deloitte, somebody senior who had sort of broken down some of the barriers already and made themselves available for people to go and speak to confidentially. And through speaking to the mental health champion, I was then able to be really advised on the best sort of route for me to take. So then went and spoke to occupational health and received further support from that point on.
Many people feel that if they are to admit to suffering from some kind of stress-related depression issue, they will be regarded as weak or as incapable of doing their job. I think we've made some significant strides to improve the culture around that, and indeed that's what today's event is about.
I think the most supportive part of what people at Deloitte were able to do for me was, first of all, taking my problem kind of seriously and giving me the time and space that I needed to actually deal with that. So ended up having about 3 or 4 weeks off work. And then the support once I came back into the workplace, so that was on a phased return basis. So both the support I had from occupational health in putting that in place, but then also support from colleagues to actually make the phased return work effectively. That was really the most important part. I think it's absolutely vital. I think in terms of leaders and senior people speaking out about mental health, trying to reduce some of the stigma, trying to really sort of advocate an open culture. That's really, I think, the only way that we're going to get improvement across the board in terms of how these issues are dealt with. I think it's important for Deloitte and all companies to invest in mental health programs for a number of reasons, not least of which is the fact that actually from a business point of view, it's extremely important to have a workforce which is healthy, happy, productive, so that people are taking less time off. Obviously the cost to organisations of people taking time off and then having to, for example, like myself, have a phased return can be really, really high. So actually from a kind of business and economic sense, it's really important to invest in keeping people healthy, both physically and mentally.